Ieri mattina mi ha avuto grande dolore. L'altro giorno c'avevo vomito. No, non si. I even said to stay with him.
I make it time for dinner, and the offering is impressive.
All right, thank you very much. I think we will start. I'm just going to record this. Oh, it's already recorded. Thank you, Ellie. So we have lots of people on the call. So if you have any questions, we have our team members who are in the chat. You can put your questions in the chat as we talk along. And then we would answer those. At the end, we would also allow for people to ask questions as well. My name is Teddy. I'm a clinical research fellow with the Global Surgery Unit in the University of Birmingham. Thank you all for taking the time to come, and hopefully we all get something out of this. So the two main things, or the two main highlights for today is we're going to talk about the mini team registration or the collaborator registration, and then more importantly, the data collection tool. So I know there has been some people who have not received their logins. We are aware of that. We'll be issuing logins again today for those who have not received their logins. So that would definitely come. But it's, even if for any reason you don't get your logins before Monday, you can always collect it on data, and once you receive it, you can transfer it onto RedCap. We are trying to streamline things going forward in terms of when we issue logins. I'll come to that later on in the presentation. Actually, I can just show that now. So we'll share this particular table with you. So this is to the hospital leads so that you know on which days we will be issuing logins, because it's quite a complex process and we try to do them in bulk. So we'll let you know which, so these are the dates where we would issue logins. And so you know that if you have entered details for a particular collaborator on or before those days, then they should receive their logins to be able to enter data.
Hello.
So without much ado, I'm just going to ask Corty to start to demonstrate how the data collection tool is on REDCap and some of the things that may pose challenges once you start collecting data. So there are different aspects of the form. So Corty is going to go through, and then on each, when he finishes one particular section, he's going to pause. And then if you have any questions, you can ask, and then he moves on to the next. After that, Virginia will go through the sub-studies. So as you are aware, we have two sub-studies. One is open to everyone, and the other one, so the first one, which is waste management sustainability, is open to everyone. And then the finance one is only open to 7 countries. If you are not from any of those countries, you wouldn't have access to the finance one, but then everyone has the option to be involved in the waste management sustainability. So if Ellie, if you can allow Corty to share his screen, we can start from there.
Can you hear me? My name's Corty. I'm one of the clinical fellows working with Teddy. So I'll walk you
Corty,
through.
your volume is very low. Sorry.
Oh, thanks for telling me. Sorry. Better. Is that better, Teddy?
Yeah, I can hear you.
Okay, sorry about that. Okay, so I'll be walking you through the data collection, the main data collection. So when you go into your REDCap, you should see a page like this, and when you get to add new record, and you'll start with starting page. So this is just to make sure that you have everything ready. So the first thing we need to make sure is that you have the permissions in place with your hospital, because that's very important. Oh, sorry, fire alarm. Okay. So once you've got those permissions in place, you can collect data. So for example, let's start with the period 1. And now we have the optional sustainability sub-study, which is optional for your hospital. So if you don't want to partake, you can say no. But if you do want to, you can say yes. At the moment, we'll say no because Virginia will be going through it afterwards. Okay, and then you save and you move on to the next one. So this would be the demographic page. So you put in the age, the sex, put comorbidities that you want to do. ASA grade, so that's often will be calculated by the anaesthetist. So if you need to find that, it's often good to look at the anesthetic notes. Previous abdominal surgery, and this question is for previous episodes of right iliac fossa pain before the submission. So did they have right iliac fossa pain and didn't think a suspicion of appendicitis, or did they have appendicitis that was conservatively managed, or for whatever reason they couldn't afford a surgery? So this is for previous admission. Okay. And then the next page, you'll go on to the presentation. So this is for this current admission. So what did they present with? Let's just say right iliac fossa pain, loss of appetite. What signs did they have? So roving positive, or I don't know, right iliac fossa tenderness. Immediately prior to the hospital, did they seek care anywhere else? So that's what we're looking for. See if they went to the GP. Did they go to a traditional healer? These kind of things. And then below you can type in GP, for example. Okay, time from symptom onset. So these are just broken down into categories of time, and then time from first assessment of the surgical team to the patient arriving in hospital. So again, broken down into time. If there was a appendicitis risk scoring, then please indicate that. But if not, then just say no. And if there's another one, you can write that there. Next bit is looking at investigations, so ultrasound, CT, or MRI. So if they've had that, please indicate. And then we're also just collecting blood tests, just CRP and white blood cell count. So if you can, if they've had that, it would be really helpful if you can put it in the format that we have put here. So if you need to change it from, I don't know what your lab reports, but if you need to change it into that specific like milligrams per liter, then you can use an online calculator to do that. That would be really helpful. So and then we have who's reviewed the patient. Going on. So this is just because I haven't filled it in properly. So that's just a reminder. Okay, who was the most senior surgeon scrubbed in? Time of night to skin, so either day, evening, or night. The approach, so open approaches. And in these, we have a bit more information that we want to do. Why didn't they have laparoscopic? So did they not have the equipment? Surgeon preference, unstable electricity supply, or did they have laparoscopic surgery or robotic? And then if there was any additional procedures, right hemi, small bowel resection, or gynae, any of these. And then the macroscopic appearance. So what did the appendix look like intraoperatively? Was it simple? Was it complex? And antibiotics either preoperatively or in that induction. And then we also want to capture if there was any power outages in the perioperative time. So let's say if there was a power outage in the operation, how long did it last for? And were there any changes? So if you were using laparoscopic, did you have to convert to open? And please as well, it'd be useful to just write down a few words about if there's anything else you have to do different. And then we're just asking you to judge whether the power outage you think contributed to any impact. So minor or severe complications. So this is just impacts related to the power outage. Okay, so we're going to leave because I haven't done everything. Then we're looking at antibiotics administered in the post-operative period. Okay, so we've got, let's say yes, then it opens up when were they administered. So less than 24 hours, 24 to 5 days, or greater than 5 days. And then if you can indicate which class of antibiotics they had. So let's just say penicillins. And it would be really helpful if we can fill that in. You have to look it up. That would be really great. And then what we
Arrivo subito, signore, un attimo solo, sa.
IV or both. And then afterwards, looking at surgical site infection or unplanned operation at 30 days, if you can collect that. And then looking at the 30-day overall Clavi and Dindo score, and we've given you the classification above. And then, sorry, I've obviously done this. So it will tell you if you've suggested something incorrectly. And then post-operative stay, let's say 2 days. Readmission, let's say 2 days. And then histology, so looking at the histology, so let's just say simple appendicitis. And then just make sure at the end whether you confirm whether everything is correct. So maybe if this patient didn't meet eligibility criteria, for example, it was an elective cancer appendicectomy, or it was a test, which mine was. And that's it. I think that's covered everything. I know there's been a lot of questions. Teddy, do you want me to just run through these, or should we wait and move on to the next?
Hello. Yeah, I think we would let Virginia go through the finance bit. If you have any questions, please put them in the chat and we would answer you as we move along. Hi, Virginia.
Hello. Can you hear me okay?
Yeah, we can hear you. We just
Oh.
can't see your screen.
Yeah, give me 1 second. Can you see now?
Yes, I can see your screen.
Okay. So as Courtney mentioned earlier, there was a section on sustainability on the main data collection. So this is the form. Is that, Teddy, am I in the right place?
You are in the right place.
Okay, perfect. So is the form for sustainability is divided into the sections of anesthesia, then something looking a bit more detail in the equipment, and then something about waste management. So it starts off with the anesthesia section. This is asking for the background of the anesthesia provider. So whether that was a physician, a consultant, or kind of resident registrar level, any other anesthesia provider, if it's a nurse anesthesia provider, or a non-physician anesthesia provider. And then it will go in a little bit more detail about what mode of anesthesia maintenance. So not for induction, this is during the operation to keep the anesthesia throughout the case. And whether it's general inhaled, and so you can click all the apply, and then you can click, so if you click general inhale, it will ask you specifically what anesthetic gas was used. If you ask about total intravenous, it will ask what anesthetic, non-inhale anesthetic agents were used. And then for the regional and local, again, it'll give you the option for the regional, and then for local, again, it'll give you any other non-inhaled anesthetic agent option. And again, for sedation, it will offer that option again. And then for other, it will just specify again what other types. So then we'll go into detail about the equipment. And then the equipment, you'll see that you've got 3 tables. So the first table focuses on anesthetic equipment. The second table focuses on whether the procedure was done, was an open procedure, so open equipment. And the third table will be about laparoscopic equipment. So the options are whether you've used something that was, during the case, something that was reusable was used, or something single use that was used once and then disposed of, or something that was meant to be single use but then was sterilized and used. I hope that is clear. And then, of course, if that wasn't used during the procedure, you can always put not applicable. So there is kind of, it goes in quite a lot of detail because we're really interested in capturing this part of the operation. So yeah, it seems like a lot, but it's all kind of stuff that you should see there. And if it's not used, just click not applicable. And then there gives you an option to add anything else that we might have not thought of. And then, yeah, finally goes into the laparoscopic equipment, and that is exactly the same. And then we'll go on to the solid waste management. And here really it's just quite simple because I know that there will be a hospital level to go into a little bit more detail on that. But with regards to solid waste, it asks whether it will be collected, it was collected all together with no differentiation, or whether there was some difference in collection. So different waste was collected differently. And then if you click, if it was differentiated into clean and contaminated, it will ask how was it collected separately. So whether there were bags of different colors used, it were clearly labeled, and you can tick both if both were done, or whether there was no clear differentiation between the two. So you've got your option for this too, and then it'll ask you whether sharps were collected. So this is really the sustainability form, and this is for all patients in all countries. And then I'll move on to the finance form, which is instead for only 7 countries, which is the 7 hub countries, I believe. So It's Mexico, India, South Africa, Nigeria, Benin, Ghana, and Rwanda. So for here, basically the finance form goes in a lot of detail with regards to how did the operation, who paid for the operation, and what were the costs. So again, if you're doing the finance form, take a little bit of time to just make sure that it's completed accurately. So the first question asks about payment mechanisms. So whether it was public insurance, private insurance, corporate insurance, external funds or charities or NGOs, out-of-pocket payments, whether you're not sure or other. And for the insurance options, okay, no, oh yeah, okay, fine. And then it will ask you, how was the majority of the cost of the care supported? And in this case, you'll see that if you click what the insurance ones, it'll still ask you whether did the patient pay part of their care as out of pocket. And if yes, like how what are they paying out of pocket? And if no, it won't give you any other options. So it will ask you the total cost of the care received, the cost paid out of pocket by the patient, how much of the patient's how much is the patient's household monthly income, and how much is the patient's, like individual patient's monthly income. And then it will ask you about the patient's discharge destination and whether there was whether there is the patient is self-employed or in self-employment. So sorry, is employed or self-employment. And if he is in work, how many days did that take the patient to return to work after the operation? And if not in work, how many days did the patient take to return to their normal activities? And in summary, I think this is the finance form. Anything else you'd like to add, Teddy?
No, that's it perfect. What I was just going to say was it looks a lot. What we're going to do is make videos of both the main data collection form and then also of the sub-studies, very short videos, 5 minutes. So you can go through those videos and then see how the form is being filled by someone else. In addition to that, we're going to send out a data dictionary that describes what we expect or what the different fields might mean and how that might vary from center to center. Are there any questions that have not been answered in the chat? We'll just be taking those in now. If anyone wants to unmute and ask a question, or our team can pick up any question that is being repeatedly asked. Okay, so over here I see a number of people asking about the sub-studies. So from previous meetings we've had, which are on our YouTube site, we have talked specifically about the study and also on the protocol. So we have two main sub-studies. There's one on financing and there's one on sustainability and waste management. So like Virginia mentioned, the sustainability and waste management sub-study is available to anyone who wants to take part in it. The finance sub-study is only for specific sites or sites in 7 countries. Now, it is a bit challenging looking at the questions, and that is why we have allowed for a separate team to actually collect the sub-study data. So they would be specifically only taking the data for the sub-studies for the study. Everyone else will do for the main study. And yes, data collection starts on Monday. So I was saying earlier on that even if you do not have your logins before Monday, you can collect the information on the paper CRF which we've sent out to all the hospital leads. So you should get that from your hospital lead. So you can take off these points on your paper CRF, and then you can enter it into REDCap later on. Okay, I'm just trying to go through the chats to pick up some questions. All right. So questions about consent forms and patient information sheets, PIS. Not every site needs that. It depends on what is acceptable in your local setting or what your local approvals require. Many sites will not need a consent form or a PIS, but if your ethics board requires that or your hospital requires that, then obviously, yes, you need to use it. The presence of the consent form or the PIS doesn't mean you really need to use it if you don't need to, or if your center doesn't require it. So for the sub-study, for instance, especially a finance sub-study, because you would be speaking to patients, you would need consent, or most people would require consent to collect that data. So yes, if you're involved in a sub-study, you should find out what is required locally and get consent if needed. Team members, are there any questions in the chat that we need to highlight?
Teddy,
Yeah, Maria, thanks.
I think from the questions, some of people, can you show again the slide where you showed the timeline for mini-team registrations and hospital lead registration? Because there was quite a common question about when is the last, like if a new hospital wants to join, when is the last date that they can join? And then for mini-team registrations, if you could share again the table that you showed in the slides previously, I think that will be helpful, please.
This table.
Yeah.
All right. Yeah, so the last date for registering would be before the last period. So because some people might want to be, I mean, we want everybody to be involved in data collection for all periods, but maybe for some reason you may not have like your team set in place, and you might want to start joining the study in the third period. That's fine. So because of that, the period for registration would be open up until a couple of weeks before the start of the last period. So that's with the opening dates for the study. So this table is just showing that for the first period, or let's say the second period, because we're almost done with the first period. For the second period, which starts on the 17th of February, if the hospital leads would get their collaborators registered on a mini team by the 9th of February. So that gives us some time to issue logins to all those collaborators who have been registered. Now, like I keep saying, even if the collaborators miss the cutoff points for their period. So for instance, you were supposed to be, or you were not registered before 9th of February, you'll be mopped up into the next time we are issuing the logins. And so you get your login for the next period. That means that you would have to collect the data on paper from until the next week when we issue the logins for you.
Can I just
And
clarify?
if Teddy, and if a new hospital wants to join, so I guess this is from the EOI.
Yeah.
What is the deadline for that?
So that will be opened. There's no deadline for strict deadline for the EOI up until a couple of weeks before the last period. So the last period is starting on the 12th of May. So we'll close the EOI from the beginning of May.
Okay.
Yeah.
Can I ask a question follow up on
Yes,
that?
please.
So
Yeah.
just to clarify, for example, the period that starts from the 3rd of February, which is Monday, that
Yeah.
means if the mini teams aren't registered by the 26th of January, they will not be eligible to participate in the run from the 3rd of February. Is that correct?
So not exactly. They will be eligible to participate. It's just that they will not be able to enter because they've not had their logins, they will not be able to enter data directly into REDCap. They will be able to collect the information on the paper CRF and then transfer it onto REDCap once they have their logins. But for the first period, we are issuing another round of logins today. So everyone who has been entered into the mini team registration by their hospital leads should have their logins by the end of today to participate in or to enter data directly into REDCap on Monday. But if the data is not in today, and if the hospital leads fill it in tomorrow or Sunday, it's not a problem. They won't get their logins for Monday, but then when we are issuing logins the next week, we would issue for all of them. So then they would transfer the information they've collected onto REDCap.
Retrospectively.
Yes.
Good.
And
Thank you for that.
yeah, thank you. And also to clarify, for some of the mini team registrations, you have the same like group of people who are collecting data across the 8 periods. You don't need new logins to enter data. You can use the old login you have. We would only issue logins to new people who are now joining the study. So for instance, if in your hospital, collaborator A, B, and C are collecting data for period 1, and the same collaborator A, B, and C are collecting data for all the 8 periods, they don't need new logins. They can use the old logins that they have to enter the data. But then if in this same hospital or in a different hospital, you have A, B, and C collaborators for the first period, but then for the second period, you have D, E, and F. And D, E, and F would be issued new logins, if that makes sense. So we will only issue logins to new people being added to the study. Yeah, Alazar, please.
Hi, Teddy, and hi, everyone. I just want to check about the CRF. Is it something that can be downloadable so that individuals can put the information, every information in that form, and they don't have to have their own format of collecting each variable? Is that the case?
Yeah, there's a downloadable CRF on the websites. We'll put the link in the chat as well.
Maybe that would.
Yeah.
Great. That would be helpful. Thank you, Teddy.
Thanks.
Hello, Teddy. Can I ask a question?
Hi, yes, Maha,
Yes.
please.
Hi, Teddy. I just wanted to ask, my hospital lead, and I am the co-lead at the hospital. We have registered ourselves for data collection for the first period. Do we need a different REDCap login from the one that we already have to put in the data?
No, you don't need a new login. So you would use your own login.
The logins that I already have.
Yes,
And
yes.
I have almost already registered all my teams for all the periods, all 8 periods. I've got teams, and they're not the same people, so different people. So if I submit the form today, not all of them will get logins. They will just keep on getting logins as their study periods can come in closer, right?
Yes, yes,
Oh,
perfect.
okay.
So yeah, thanks for asking that. And also just to reiterate that the co-lead and the hospital lead would have access to the data collection instrument as
All
well.
right.
Because the co-lead and the hospital lead are responsible for the data in that particular hospital. So they would
All
have
right.
access to the data that is being collected, and they would have
Okay.
that access through their existing logins.
Okay, that's fine. And I think that that will probably just come up when my mini team registration is complete and when I've submitted. Then when the first data collection period starts, that's when it will start showing up on my account, right?
Yes.
Okay. Teddy, I'm sorry, just a last question.
It's all
As
right.
I'm going through the mini team registration form, there's a section that says logins issued, but that is not something that is editable by me. So that will just be sorted when by yourselves when
Yes.
the all right, okay.
Yeah. So that is a read-only field. So that has, I mean, it's just an admin field for
It's
us.
just an admin thing, nothing for us. All
Yeah.
right, okay, that makes sense.
We would actually hide that field from view.
All right, okay, that's good. Thank you.
So you
Thank you so much, Teddy.
worry
Thank
about
you.
that.
Thanks for
No
all your
worries.
hard
Thank
work.
you.
Hello.
Hi, Jafta.
Yes, sir. Please, I have one quick question. So, for our institution, those for the period one have received their logins, but we don't have ethical clearance yet. Can they still go ahead and input it directly into the red cup, or we should wait for the ethical clearance before we can go ahead?
Yeah, please wait for ethics before you upload anything onto RedCap.
Oh, so we should do the hard copy for now till we get that.
Yeah, so the data you enter into RedCap would be data that's covered by your ethics. So you wait to get an ethics approval, and then you can upload onto RedCap what the ethics covers or the duration the ethics covers. Yeah.
All right. Thank you very much.
Thank you.
Hello.
Hi.
Hello. Yeah, am I audible? Hello.
Yeah, we can hear you.
Okay, so I have some questions regarding some points in the form of mini teams. So
Yeah.
there is a form for mandatory hospital site survey. So is it like that we have to fill the form and send to you guys before the study starts?
Okay. Is that your only question, or do you have a few more?
I have some more questions.
Okay. So if you ask all of them, I'll address them.
Okay. So my next question is in our hospital, the ethical committee always wants the source for the financial source for the study. So can you tell me about the financial source for the study?
Okay.
Okay. And my next question will be that for the sub-studies, do we need to enroll the hospital leads as well as co-leads in the sub-study, or we can spare some of the other residents in that in those studies? Is it mandatory for the hospital lead and co-lead to be there in the sub-study? The name?
Okay. Next one.
Yes, this much I think will be.
Okay, only 3 questions. All right. So your first question, the mandatory hospital level survey would be open to all sites at the end, towards the end of the data collection period, because by then we would know which hospitals have actually been part of the project, have actually contributed to the project. So those hospital leads will have the chance to fill in the hospital level survey form, and that form is actually linked to the authorship list. So you go through the authorship list, make sure all the names and everything you need are correctly ordered, and then you fill in the hospital level survey. So that survey will be open or will be accessible by only the lead and the co-lead, but it would be towards the end of the study, not now. And you'd have to fill it directly onto RedCap. So that's the first one. Your second question about the source of financing. So we don't have external finance for this particular, for all our cohort studies really. And there is a finance letter that is on the website as well, and that details this clearly. So you can give this to the ethics team if they're asking for it. All right. And your third question about the sub-studies, the composition of the sub-study can be anyone. It doesn't have to be lead or co-lead. It can be any of the collaborators. You may choose to have different sets of people for the sub-studies and different sets of people for the main studies. That's entirely up to the lead and the co-lead. But the lead and co-lead don't have to be members of the sub-study team to be authors on papers that come from the sub-studies.
So what I understand
Yeah.
from that for the mandatory hospital site survey,
Yeah.
that those data I have to put it in the red cap at the very last day of the study period.
No, we will give you access to that later on in the study, at the end of the study. You don't have access to that now.
So right now we don't have to send anything to you guys.
No, not now. No. So you'd
Okay.
have to fill it on RedCap, and we'll give you access to that towards the end of the study.
Okay.
Yeah.
Thank you so much.
Thank you. Any other questions?
I have a question to ask.
Yes, please.
Yeah, actually, in our hospital, we have separate surgical teams for pediatric population and adult population. And I register myself as a co-lead under my hospital lead for the pediatric population. And I
Yeah.
also submitted the registration form for the adult population with another hospital lead and myself as a co-lead. So
Yeah.
my pediatric application has been approved, but adult application isn't yet approved. And is it possible? I mean, is there any? Can we be? I mean, a co-lead in both of the for the both of the population, or just a person can be a lead only in one population in the same hospital? And I have another question. For our hospital, I mean, for the ethical review committee, they have a fee for the ethical clearance. It's around $200 for the ethical clearance for this project. So is there gonna be any funding from the central team, or I mean, any suggestion for that?
Okay. All right. So your first question, yes, you can be co-lead for both the pediatric and the adult team. If there is already a team that is in place in the adult service that have already been confirmed, then no, you can't be. We can have two leads in the adult team. So is one, either there's already another lead and co-lead for your adult service. That's why you have not been confirmed yet, or your cases are waiting review. But you definitely can be a co-lead for both adult and pediatric service. Number two, so with regards to the financial question, we do not give external funding for our cohort study, unfortunately. So there's no funding for that. Maybe one thing you can tell you can say to your ethics people is the fact that this would essentially be an audit of your cases, or a service evaluation of the evaluation of the service you provide. And perhaps you shouldn't be charged to look at what your outcomes of service that you provide can be. But if they are still very insistent that you have to pay that, unfortunately, we don't have funds for those.
Okay, thanks for the answer. But my registration for the pediatric team is approved, and there's no team covering the adult population in my site. But still, I submitted the application for adult team twice, and it isn't showing in the hospital registration list in the red cap. I mean, in the website.
Okay.
And
are you on any of our WhatsApp pages?
WhatsApp pages? Sorry, I didn't get that.
Are you on any of our WhatsApp pages?
Yeah, I'm using WhatsApp.
Okay. why don't you send an email to us about this particular issue? What's the name of your hospital?
It's Chittagong Medical College. It's Chittagong in Bangladesh. I emailed twice in the last week and didn't get reply.
Okay. All right, that's fine. That's fine. We'll get to it.
Thanks. Should I do the registration again for the adulting?
No, no, no. If you've already put in a registration, don't put it in again. We'll have a look at it.
Okay, thanks.
All right, thanks.
Can I get the WhatsApp page invitation?
It's a hospital leads WhatsApp page now. We'll send one for the collaborators later.
Thanks for your help.
Hello.
Hi.
Can I ask another question, please?
Yes, please.
Okay. So I was reading the study protocol, and I came to one of the points that when we are registering the study in our ethical committee, there is one statement.
All right, next question, please.
Yes, can I ask?
Yeah.
I'm sorry. I just didn't get the invitation for the WhatsApp group. I'm the lead in my hospital, and the other question was my hospital by now should be named in the list that you have in AlliGatOr's page.
Yeah.
Okay, so it still isn't showing.
Okay. From the EOI link. So when you open the EOI link, there is REDCap only returns the first fraction of the result. So you'd need to select all. You need to select all from that list before it would show you every result that's on there. If you don't take that all, it will only show you maybe the first 1,000 people who have registered, and you might probably be number 3,000 or something, so it won't show. So if you are definitely confirmed, then you need to click on the all, and then it will show.
Okay, perfect. Thank you.
Hello.
Hello.
Hi, Amit.
Hello.
Is there any
hello?
Limited number of the blocks which we need to submit data for? Like, I haven't got ethical approval from my center yet. We will be getting it maybe in a week or two. So can we move with just the third block or the so onward?
Yeah, so if you are sure that you are getting ethical approval next week, then yes, you can take the data on paper and then fill it in retrospectively once you have ethics and it covers the period. There is no limitation on the number of periods you can take part in. We encourage everyone to be part of all periods. I hope I've answered you.
Yes, thank you.
Yeah.
Hello. Can I ask?
Hi, Diraj.
Hello, Teddy. Yes. So as I was asking that one statement I have seen in the study protocol saying that if possible, a waiver for individual patient consent should be requested. So is it like that? We should not take consent from our side, or is it the patient consent that form that has been provided with the study? That is the only consent to be taken from the patient.
Okay, so the patient consent form and the PIS were added to the documents we sent because a few sites or a small fraction of sites might require consent form to take part in the study. majority of people do not need a consent form to be part of the study. But it's difficult for us to tell which centers need it or not, so we sent it to everyone. So if you don't need consent in your center, you don't need to use it. And if you do use a consent form, you don't need to send us a copy of the consent form.
Okay, thank you very much. Acha, I need a little clearance over the ethical part of the study. That
Yeah.
I have already applied for the ethical part of the study in my institution. So, is it necessary before the data collection blocks that we have to get the ethical clearance from our institution?
That you need to get what? Sorry, I didn't get the last part.
Is it necessary to get the ethical clearance first from our institution before the study blocks starts?
Okay, yeah, you need to get ethics from, I mean, you should have received ethics. So some people have applied for ethics, maybe.
No, I have already applied for the ethics before the ethical committee of our institution.
Okay.
So get the clearance before the start of the study, the data collection. Since ours is starting from 17th Feb, there is a second block.
Okay, so I think that if you've already applied, you are just waiting to get feedback from the ethics team, right?
Yes.
And in your ethics application, you said you were starting data collection from 17th.
Yes.
Okay, so then if in the ethics you said you were taking data from 17th, then yes, you need to stick to that.
Okay, so before starting, before the 17th, we need the clearance from the ethics.
Yes, or if the ethics is, say, going to come maybe in first week of March, but then the ethics is giving you clearance to actually start data collection from 17, then yes, you can take the data on paper first. Once you do have the ethics clearance in hand, you can now transfer them to RedCap.
Okay, so whenever we get the clearance, we have to upload the data in the RedCap.
Yes, please.
Okay. Thank you.
Thank you.
Thank you so much.
All right. If there are no other questions, we will.
Hi.
Hi.
Sorry about the last question. My name is Ye. I register as an audit in our looker department for this, and the looker department was asking about when will the final reports be published, and in the report, will it break it down to the site specific reports? If not, they were asking about can they get a look at site specific report like separately? So that was their question. So I wondering can we do a separate look at specific reports for the local department, local audit departments? Thank you.
Okay. All right. So yes, with regards to timing for publication, we will lock the database in July, and we would take about a few months to sort out the analysis. So we are looking at, looking at December really for publication, in terms of publication. With regards to what data we are publishing, we are only publishing data at regional levels. So at whole regions, we won't publish like hospital level data. But then if your hospital or if your site is interested in what your data looks like, you can request for that, and we would give that out.
That's great. Thank you. Thank you very much.
Thanks. So what we plan to do over the data collection period is to organize these drop-in sessions for collaborators and hospital leads who have like specific questions they want to ask. And these will be done at regional level. So for instance, Sub-Saharan Africa would have their own drop-in sessions. Oceania, Australia, New Zealand will have their own drop-in sessions, Europe, America, so that the timing would benefit, I mean, different people according to what is useful for your region. So there'll be opportunities to troubleshoot in the coming weeks. And so if you have any further questions or any challenges, we can address those there. We would share this recording on our YouTube page. We'll put a link in the chat now. So you can actually access other previous recordings regarding the project. And as I said, we'll do these short recordings of the main data collection and also of the sub-studies, so you can know how to fill it in case you missed some part of it in the beginning. Okay. Before we go, there's something I wanted to show you. I don't know if you can see my screen. So, please, can you mute? Yeah, thanks. So we've developed this AlliGatOrGPT. I don't know if Dimitri is on the call. I want to say something.
Yeah, thank you, Teddy. Great to see so many people online and so enthusiastic about the study. Really great pleasure to have the opportunity to work together again. So the concept behind AlliGatOrGPT is to make it easier and faster for you to get answers to some of the more common questions. So what we've done is we've fed into this custom GPT, the study protocol, and as well as various other materials, which means that you should be able to put in a question about alligator study, and it will give you quite a good answer most of the time. Now, that doesn't mean that you'll get the answer every time, but you might, I think 80% of the time you'll get a good answer. If it doesn't answer your question, then just send us an email. We'd be happy to get back to you. But I think on the whole, it will give you faster answers than if you're emailing us. So that's really good. The other thing I'd encourage you can see that Teddy has demonstrated, it's giving us the name of the Libya alligator lead. We've got a link there to an evaluation form. So as you're using this tool, please do complete the evaluation form, just so that we can learn about what works, what doesn't work, what we can improve, and hopefully we can make it better. But I think, Teddy, why don't you put in a question like, I don't know, let's say, do we need to consent patients to take part in AlliGatOr?
Okay.
Whilst Teddy's doing that, I've seen there's quite a few questions in the chat about WhatsApp groups. So I think the best thing will be is if we drop you an email, as in we drop an email to all the leads with the relevant links to the WhatsApp groups. And then you'll be able to join relevant groups using the links. I think that's probably the best option. So I think what Teddy has just demonstrated is that he's asked the question in French. So I don't know how good Teddy's French is. That might be in with Google Translate. But you can see that it's given us an answer back. So I think you can use this tool in different languages, or you can try to anyway. And I think it's giving you fairly sensible advice there about consent. So yeah, so that's it really. I mean, I think one other thing to do is when you're filling out your ethics forms, for example, or study approval forms, you might want to use AlliGatOrGPT to help you draft some of your answers. You always need to check them, It's your responsibility, anything you submit, to make sure it's accurate. But I think it can help reduce some of the time and effort required by giving you at least an initial draft to some of the questions you have. So please do use it, and please do feedback to us on how you find it and how we can improve it, and please do share it with your teams as well. Back to Teddy.
Thanks, Dimitri. Yeah, I think this will be quite useful. And the evaluation form is the shortest evaluation form you'd ever see. About 6-7 questions you just need to take. It will take literally 5 to 10 seconds to fill it in. We'll be grateful for your feedback and see how we can improve things. Like I said, we'd have bespoke meetings. And so any questions you'd have, we will be happy to address them. And if there are no further questions, I will bring this meeting to a close. And thank you all very much. And I'm excited for the next steps.
Thank you.
Thank you so much.